How do TRAb antibodies cause Graves' disease symptoms? Imagine your immune system gets confused and starts attacking your own body. In Graves' disease, this confusion involves antibodies targeting the thyroid gland. These antibodies are called thyroid-stimulating hormone receptor antibodies, or TRAb for short. They are a key part of what causes the symptoms of Graves' disease. Normally, the thyroid gland is controlled by a hormone from the brain called thyroid-stimulating hormone. This hormone tells the thyroid when to make more hormones and when to slow down. But in Graves' disease, TRAb antibodies act like a false signal. They bind to the receptors on thyroid cells, called TSH receptors, and trick the gland into thinking it needs to produce more hormones. These antibodies essentially mimic the action of thyroid-stimulating hormone, causing the thyroid to grow larger and produce too much thyroid hormone. This excess hormone leads to symptoms like weight loss, feeling unusually hot, rapid heartbeat, nervousness, and sweating. There are different types of TRAb antibodies. The stimulating ones are the main culprits in Graves' disease because they keep the thyroid overactive. Some other types can block the receptor or just sit there without doing much, but they are less involved in causing the typical symptoms. The stimulating antibodies also affect tissues outside the thyroid. For example, they can cause problems like bulging eyes, known as Graves' ophthalmopathy, and skin issues called dermopathy. This happens because TSH receptors are found in other tissues, like in the eyes and skin, and when these antibodies bind there, they cause inflammation and swelling. The immune system's response involves B cells that produce these antibodies and T cells that help sustain the inflammation. This ongoing immune activity damages tissues and results in the symptoms we see. Treatments for Graves' disease aim to lower thyroid hormone levels or remove the source of the problem. These include medications that reduce hormone production, surgery to remove part of the thyroid, or radioactive iodine to destroy overactive cells. All these approaches help decrease TRAb levels and lessen the immune attack. In summary, TRAb antibodies cause Graves' disease symptoms by binding to and activating the TSH receptors on thyroid cells, leading to excessive hormone production and systemic effects. They also contribute to inflammation in tissues outside the thyroid, which explains the eye and skin symptoms. Understanding this process helps doctors diagnose and choose the best treatment for each person. If you think you might have Graves' disease or are experiencing symptoms, it is important to consult a healthcare professional for proper testing and personalized care.